Postnatal depression is common and underdiagnosed, and it can disable the mother and affect the whole family. There's a lot of interest around the world to see if you got nurses to visit mothers soon after the birth, you could make a difference. Well, research in London has suggested that that isn't necessarily backed up when it comes to depression.
Traditionally, health visitors have tended to focus on the baby. Is the baby growing okay? But we know that what's also important for the baby is that the mother is mentally well. So we specially trained health visitors. So they're very much about listening to a woman's problems and thinking about those problems with her.
Health visitors are specially trained nurses who care for people in the community. In this case, new mothers with their babies.
They were offered between 4 and 8 visits, and then the interesting aspect of the trial was for those women who felt that whichever intervention they'd been randomised to hadn't been helpful enough, they could then cross over to receive the other intervention, which of course is what happens in clinical practice. If something doesn't work, you try something else.
And the results?
The results were that when we look at the 4-week outcome data, so that's for women who'd either received antidepressants or the general care that they would normally receive, more than twice as many women who'd received the antidepressants significantly improved and no longer had a significant depressive illness compared with the women who'd received general supportive care. And then at 18 weeks, by which time they'd had further treatment of the antidepressants, or they'd also had the counselling, or they could of course have had both, we found less of a difference.
And why did you use antidepressants and not cognitive behavioural therapy, which might have worked just as well without the potential side effects?
There has already been a trial comparing cognitive behavioural therapy and health visitor listening visits, and that found no difference between the two, but found that both were better than general care. The reason for looking at antidepressants with general care is that the guidelines in this country had suggested that watchful waiting, i.e. active monitoring, was appropriate in the first instance. But what this study shows is that actually just watching doesn't allow women to get better, and that the most benefit was got from people who started those antidepressants promptly. I should just add, though, that these weren't cases of mild depression, and clearly it may not be necessarily appropriate for somebody to take an antidepressant if the woman has got a mild depression. These are people with moderate or severe depression.
And how would you define that in common terms?
People were really very severely affected by their depressive illness, so they were having difficulty in functioning, maybe crying a lot of the time, having sleep difficulties, some had lost their appetite, and this was a sustained problem.
So whether or not a mother got antidepressants depended on the severity of her depression. Another finding from this study was the extent to which postnatal depression is still missed by all health professionals. The condition remains hidden.
These people, remember, also have not been identified by any of their primary care services, not by their general practitioner and not by their own health visitor. So there were people with really significant depressive illnesses in the community who hadn't actually had that established by services, and it was because we sent a questionnaire and they sent back the symptom profile that we realised that there were people there suffering but not actually known to services.
And has anybody assessed the effect on the babies? Because this whole infant psychiatry movement would suggest that you can just look at the baby and you can tell whether or not the mother's depressed.
We wish we'd have had funding to look at the babies and their outcomes as well, but we weren't able to look at that. And I agree, there's lots of evidence to show that depression does have an impact on the baby, and it's really important to know whether treatment is also going to therefore ameliorate those effects. Actually, women felt that in many cases their problems were stopping them functioning and talking wasn't enough. They needed an antidepressant, and therefore they did then go on to the antidepressant. But what was interesting was that originally they admitted in these interviews that they hadn't wanted to take a pill. They were worried about the stigma of it, getting dependent on it, side effects, but actually once they had had a conversation about that, and maybe more than one conversation with their health visitor who was trained to not only do listening visits but also understand the whole care of the woman, they then might think, actually maybe that's not such a bad idea.
Research conducted in Australia suggests that there might not be any such thing as postnatal depression, and that when you look at women who are depressed after the birth, they've actually been depressed before the birth, particularly in pregnancy, and what you're seeing is a worsening of a pre-existing condition. Where do you sit on that debate?
That's a big question.
And you've got 1 minute left.
As we did look at a history of depression when we did the analysis, so we certainly corrected for that, adjusted for that. We know that a lot of postnatal depression does start in pregnancy, and this idea that everybody with postnatal depression experienced it de novo is not accurate. However, there is undoubtedly also some women do actually experience a depressive illness postnatally when they haven't experienced it antenatally. And there is some evidence to suggest there might be a subtype of women who are particularly prone to experience depression in the postnatal period.